Today is 5th November 2018. This is a video to show how this dog's surgery has been performed. This is surgery is called enucleation, removal of the eyeball due to severe injury and pain. And I'm just describing the surgical procedures. This surgery was done about 1.5 hours ago. Show the eye. The eye is stitched up already now. Okay, so I will go through the surgical procedure. Use the. Okay, we start with the first part is the lateral canthus. So first part I will cut the lateral canthus under general anesthetic. Cut about 2 cm. Then there was bleeding, so I will clamp the bleeder so that there is no blood all over the place. Okay, so clamp it. Then the second part I use the eye, what you call that, the retractor, to open up the eyeball, bigger exposure. Then you can see the limbus. Limbus is the junction between the conjunctiva and the sclera. Okay, lift it up and cut the conjunctiva. Then the third part will be slowly cut off the muscles all around the globe, so that the whole eyeball can be pulled out a bit, but not too hard and too forcefully. Otherwise, it affects the optic nerve and the other eye as well, the eyesight. So this is the third part. So I use electrosurgery and I slowly dissect out the eyeball all around 360 degrees. Then now in this drawing you can see that the scissors were used to cut the optic nerve and blood vessels, but I ligate it. I ligate the optic nerve. I ligate it underneath. I don't use the scissors or forceps, so I ligate it, and so that they will stop all the bleeding when I cut off the eyeball at the optic nerve area above the ligation. Then the next step is look for the third eyelid, we call it, and I use electrosurgery to cut it off. Okay, so in the end we were left with this opening where the eyeball used to be, and as you can see from the lateral canthus on this side, I use a scissor to cut the margin. I didn't use scissors. I use scissors to cut the lid, the eyelid below the eyelashes. Cut 2 strips, but stop about 1 cm from the medial canthus. That means you don't cut to the medial canthus. You stop 1 cm, not in size, as shown in this illustration. Then the next one will be to suture the lid margins, which have been removed already, to suture it. The lid margins have been removed, but you can see from here by cutting it off. So I suture the inside first, inside the conjunctiva, and after that, finally, I suture the eyelids, the eyelid margins actually, and this is the results. So I summarize it first. I just show the whole thing for any veterinary student interested in this surgery. Okay, there's a text here. Now, see whether you can turn the next page. The text continue the next page. No, here, the next page is here. Turn over. They describe the procedure. No more? Is it no more? No more already. No more. Okay, go back again. Go up to number 9. Yeah, okay. This is how they explain. Wait, number 9. No more already. So I just show the text here so that any students who wants to refer to this procedure is called, turn over here, come. The procedure is called lateral subconjunctival enucleation technique. Okay, that is the name of this surgery procedure. Okay, let's see. This is the final results. Now, there was not much bleeding because I ligate the optic nerve plus blood vessels. Without ligation, there will be a lot of bleeding. And take out this collar first. You can see that it's very important to ligate the optic nerve and blood vessels. Turn out a bit. You can see there's practically no bleeding. Now the medial canthus, of course, you don't cut off. Then I can show you the medial canthus. This part is the medial canthus. This part is not cut off, this part, so that any fluid can flow out. Otherwise, it close everything, nothing will flow out. But as you can see, there's no bleeding. Otherwise, the blood will flow from here. And okay, the lateral canthus has also been stitched up. This is the lateral canthus, about 1 centimeter. This lateral canthus, and this is the lid margin. And okay, let's look at the other eye. The other eye actually is not so bad, so I advise the owner not to take out both eyes. And the reason the owner wanted enucleation is because she went to internet to see what is the solution, instead of going to the eye specialist for the last 2 years and getting medication. Despite medication, the dog kept on rubbing the eye against the bed and the wall. So as you can see in the first video, it was very painful for the dog. Turn out a bit, so you can see that enucleation is still the best option for this poor Chihuahua. Then there will be no more painful eye ulcers, and the dog is going home soon. Okay.